Welcome, everyone, to another episode of the Black Surgeons Podcast. My name is Dr. Wibonele, and today we have the pleasure of having Dr. Eugene Bestman. He is an oral maxillofacial surgeon currently in California. You'll hear a little bit more about him in a little bit, but I'm super grateful for him for being here and just to give us a little bit of time out of his busy time and chatting with us about what he does and his journey. Dr. Bestman, thank you so much for being here.
Of course, thank you for having me. It's a pleasure. I appreciate the invitation. So, like Doctor said, I'm currently a third-year resident at Harbor UCLA, pursuing oral maxillofacial surgery. Originally from Ghana, and then making in the United States. Originally from Delaware, did my training at University of Maryland Dental School, and then currently doing my residency at Harbor UCLA.
Nice. So, just to start out, I would love to. Can you tell us a little bit more about, where you grew up, where you're coming from, where your parents are from, and, just kind of a little bit of your background?
Of course. My story is very unique. I didn't grow up like most people. My family, my dad and my mom, they weren't really around much. So at the tender age of 4 years old was actually the last time I saw my mom, and she had to make the conscious decision of taking up an opportunity to move to Europe at the time in search of just better opportunities. And so when I was 4 years old, my mom had to leave, and I didn't see her till 10 years later when I moved here. But during that period, I kind of bounced around from different family members to what you would call modern day foster care, essentially. We're just trying to, go to school and make a way out. But no one in my family really got a college degree or even a high school. Maybe my dad got a high school diploma, but essentially I didn't really have that typical upbringing that most people in my field usually get. And so I always, because of my situation at hand, for some reason I was always focused and always did well in school. And so I always found that was my escape, and I knew that was my way out into making a better life for me, especially not, growing up in the conditions that I grew up in Ghana and not having family around. I always did really well in school, so it was always my outlet, and it was always my ticket out of my current situation. And so eventually I would eventually reunite with my mom, which is in 2011 when I moved to the United States. I was 14 at the time. Um, and I remember coming into midpoint of junior year, because while I was in Ghana, I skipped 2 grades. And so I skipped the kindergarten in the sixth grade. So I was 2 years ahead. And when I moved to the States, I had the transcripts and everything to prove that this was the grade that I needed to be in. And I presented it to them. I had to take like an exam just to show, to prove to the high school here that I can handle the workload. And I did well. Eventually, they started me in basic classes, but eventually they upgraded me to AP classes. And then while I was there, I also ended up becoming class president in that short period of time. So after high school, went to college at University of Delaware. And again, being the first in my family to even make it to college, I was the first out of my family to get a college degree. And at University of Delaware, I majored in biological sciences as well as neuroscience. So I got 2 degrees while I was there. I figured
That's
I would get
amazing.
one for my mom since she didn't get a chance to get it. Extra degree was like, let me get one to my mom. But so did that, and then made my way into dental school at Maryland, and graduated from there, and then also became one of the first, I think, African American surgeons that they've produced out of that program. I only know of one other surgeon that's African American, and I think I might be maybe one of the other few oral surgeons that came out of the program. So that's essentially my story in a nutshell.
Dude, that's amazing. I was laughing because I had a pretty similar upbringing when you're talking about moving to the US,
Yeah.
taking exams, similar thing where, I took some exams, but then I didn't speak any English. And so
No
then
way.
they were like, you can't move up. You need to learn the English. But like my math scores were amazing. And so they allowed me to only skip like certain amount of grades. But so it was funny to hear that. But yeah, man, thank you for sharing, that back part of your story. It's super inspiring just to hear, and it's amazing that I have some similarities on my story on that aspect of things. But I just want to move on to like the next chapter. You talked about going from high school when you moved and then going to college. You talked about some of the challenges that you had. Can you kind of highlight some of the more challenges that you had maybe in college, or and the decision that you made to becoming a doctor or going to dental school? When did that happen?
Like I said, I just have a really, really crazy story. My path was just so non-traditional. But while I was in Ghana, and kind of on my own without any parents, I was tossed into boarding school. And if boarding school is anything like it is in Ghana, I can imagine Tanzania might not be that much different. But just like boarding school in Africa in general, man, it's a whole different beast. And but I'm grateful for it. But the reason why I highlight this is because while I was there, being young, I was playing around and I chipped and I fell and I broke my tooth. And that experience is what essentially led me to becoming a surgeon today. Because at the time I didn't have access to dental care. There was no dentist around. I was kind of in the middle of nowhere. And when I went to like the person that's kind of overseeing it and tell him, hey, this is what's going on, he kind of just like brushed it off and was like, you're kind of on your own. And I'm a 10-year-old, 11-year-old kid. I don't really know what's going on and what to do. And I didn't take good care of it. And eventually when I finally got the chance to see a dentist, it was too late for the tooth. So I lost the tooth. And it was my front tooth, the most aesthetic area possible. And kids are mean. Like kids are very, very mean. And
Hmm.
so I had to battle just, constant being made fun of and stuff like that, which to be honest never really bothered me because I wasn't one of those kids that really cared about what people said. But eventually, when I moved to the States, I got introduced to oral surgery at the dental office that I went to. And the dentist didn't know, like she knew how to restore it, but she referred me to an oral surgeon to talk about dental implants and how to permanently, like, instead of me wearing stuff like a grandma or granddad, something that's permanent. And then when I went to the oral surgeon, immediately I was like, fascinated about like a field like this and then how with the specific set of skills that this person had because this is like very specialized skills they could restore my smile again for me. And so 16-year-old me at the time was very, very like inspired. And then when I went home, and at the time I was in high school, so I went and did my research on what it took to achieve this. And looking back at it, I'm shocked that like I wasn't phased, like I wasn't scared, because it was like you have to go to college, you have to go to, this is like a almost 15-year commitment at this point.
Yeah.
But
Hmm.
somehow I wasn't phased by it. I was like, excited to do it. So high school, in terms of challenges, to be quite honest, high school, especially coming from Ghana and then coming to here, it wasn't too bad for me. And I went to like one of the biggest public schools in the state at the time. And so high school was really nice. Like I was doing well. I was killing it. But then when I got to college, that's when I really got hit with the realness, and that's when I got
Hmm.
humbled a little bit because high school, everyone was like, "Oh yeah, you're super smart, yeah, you're like great, great, great." And then I got to college, and then I realized like, man, everyone here is like very smart, and I was in like a very competitive major, so college was tough. My first semester was like below a 3.0. I think I got like a 2.7 or two, something like that, because it was just so hard. I wasn't prepared. Um, and then I remember going to my guidance counselor and expressing to her this goal that I have that I've like been thinking about since I was 16. And I don't know what it is about guidance counselors in college, but they just always like put you down. I was like,
Yeah.
why? Why don't they always have something about? Because I know I'm not the only one that can say this. Everyone I've
Yeah.
spoken to has always said, yeah, my guidance counselor told me I didn't have what it took to be a doctor. And I mean, she looked at it and she was just like, yeah, you got to get your grades up. Like, I don't know if this is going to be good enough to do it. And I
Yeah.
think part of me, I was like disappointed, but I was never discouraged. In fact, I used it as motivation to like get my grades up. So it was a challenge, but the next semester, as I started to get comfortable, I found the right group of people to hang around. The people you hang around is so important. Like-minded people, people that are motivated, people that are doing better than you. You got to always surround yourself. And I think that was the smart thing that young me in college did, was just surround myself with just go-getters and people that just had the resources. So eventually, man, I started doing really well. Dean's list every semester, just put in work, taking the criticism, even when it sucks and even when it hurts, and even when in times where I was just doing poorly. Like I remember I got like a D in my intro to bio class at some point, or a C minus or something like that. It was just like not going well. But then I flipped it around and then started studying the right way and finding the right resources, and that worked. So we finally beat the college struggle. We get to dental school, and dental school was just another different ball game. Like I thought the people in college were smart. Then I got to dental school and was like, dang, these people are geniuses. And again, I did the same thing that worked for me in college, was just like surrounding myself with the smartest people in the class because I knew what I was trying to do. And so I had a group of friends and people that I was study with, and everyone that I was around, all of my good friends and study partners were people that wanted to specialize. Like they weren't they always wanted to get A's, like even B's. It was like a huge competition. Like we were just all about it and grinding. Dental school was challenging, but I think I had a good support system. But I would say that they did get to a point where I had to decide if I still wanted to pursue this, because a lot of times you go and you just get discouraged. Like you'll meet certain professors or certain people that just say certain things or try to put you down or tell you you can't do something. And it's not like I'm new to it, being black and being African, being young, you know what I mean? Like I almost feel like people don't see you in these places. And when you make it there, they're almost like, how did you make it here? So you almost have to prove that you deserve to be there. And sometimes you go through imposter syndrome, like, do I really have what it takes? And I battled that a lot in dental school, especially around the time like my junior year where I had to start applying. It was like that dream that I had ever since I was 16. When I got to dental school, I almost gave up on the dream because I was listening to what people were saying and all that stuff. But because I just had a good support system and I had good people around me, they motivated me and they knew the right things to say. And one of my really really good friends, to this day I always share this story. Like when I was down and didn't want to do it, and this was during COVID too. When I finally made the decision to do it, I was talking to her. She just called me when everyone that I had spoken to was like, "Yeah, man, maybe you should just do general dentistry." And there's nothing wrong with it. I love general dentistry, but it's like when I talked to her, she was just like, "What do you mean? Like your story is amazing. You have good grades. You have everything it takes. Like you should go for this." It was almost like God was using her as a vessel to just tell me everything I needed to do. And once she said that, once it clicked in my mind, I'm one of those people. Once things align and click, and I finally make the conscious decision that I'm going to pursue something. That's it. It was over. I just locked myself up. I was in jail, and I just grinded and grinded and took the exam and just pursued it.
That's amazing, man. I have a theory about guidance counselors. I think they're made to be there to just motivate people, because like you
Right.
hear all these stories, it's like I don't think they're really that mean. They're just doing that so you're like you gotta get your
Right.
behind and just be like, I guess I gotta do this to get there because we all have that story. I was the same way as you. First year, first semester, I went to a pretty hard school myself. I had like a 2.8, 2.9 or something. I had a
Mm-hmm.
C in chemistry. Same thing. I was like, hey, I'm trying to go to med school. You
Oh
you
yeah.
think this is gonna work?
Yeah.
And they're like, not with these grades. And so same thing. I was like, oh, I guess I gotta change some things. So
Yeah.
and it's amazing to see. I know there's a lot of people who can go through the process and then be like, oh yeah, that was cool. But like, there's a lot of people also who have gone through the process and they have like fallen and they have gotten back up and I feel like those are the people who usually actually, I believe at least like really succeed because like they
Yeah.
have failed before. And
Right.
for somebody to go through medicine, whatever specialty it is, you have to know how to fail because like once you become an attending and once you're seeing your own patients, everybody has complications, right? Like
Oh
at
yeah.
some point you'll have a complication. How are you going to deal with that, right? So it's like a way for you to learn early on how to fail
Mhm.
and how to get back up. And because as a physician, you're not just like an AI, you are an actual person, you're a human being, and so you have to deal with all those things. And so I think failure is just such an important part of this journey, and it's great to see people just kind of highlighting that because so many times most of us would fail at something, quote unquote fail, um, think that we're not capable of doing it, and so
Right. Right.
I think it's so important that we highlight that because like people to see like okay, like it's not that I'm not smart enough or I can't do this. This is just a step back, and I need to change something about either my surrounding or what I'm doing right now to get better. So that's amazing.
Yeah. No, totally
Um,
agree with
can you highlight on as far as mentors? I feel like mentors are so important. For me, just even picking what I wanted to do as a specialty after med school, it took a mentor. I didn't know anything about ear, nose, and throat. I met a guy who was like a black guy, an amazing dude, and I was like, man, I want to be like him. And from that point, just that person mentored me, and now I'm here. Can you highlight on how did you seek? mentorship, and did you have any mentors kind of growing up to guide you in this path?
Yeah. I didn't really truly understand how important having a mentor was until I want to say dental school, until actually applying to oral surgery. Like I said, in my family, I didn't have nobody. And in college, I just had my friends, but I can't really think of anyone in college that was like my mentor guiding me. So a lot of this stuff was just me figuring stuff out on my own and having good friends that probably had good mentors or had parents that like were in medicine. So I'm really good at adapting, but also using like the resources that I'm given to the best of my advantage. I think that might probably be like, smarts is good. People are geniuses and stuff. And I would say I'm like, smart enough. But I think what really sets me apart is my hard work and my grit and my ability to just like navigate difficult situations. So mentorship for me, I can't really think of one mentor that really stands out until I got to dental school and started pursuing oral surgery. And one of the mentors that I met at the time was another black guy who I think is the only other black oral surgeon that I can think of that came out of Maryland, and his name was Dr. Everett, and he's still there. Man, I mean, it was just like it just clicked. He was just a really good, nice guy. He showed me one of the first procedures that I ever did. He wrote me some of the letters of recommendations, and he just really had really good feedbacks and things to say. But I also had a lot of other mentors too, including Dr. Everett at Maryland, that guided me. Like one of my other mentors was my pathology professor, Dr. Brooks. And one of my other oral surgery faculty at the time was Dr. Itzig. Like those people were really motivating and just you know even when other people said other things about me that wasn't necessarily true, I knew that these people would defend me in my true character. But that, it took me that long to really value mentorship and how important it was. I'm lucky that I was able to navigate through to that point, all the way up to that point, and develop and get those mentors when it really counted, when it really mattered. And so I would tell anyone, like, no matter what you're doing, like the first thing you should look into is finding a mentor, like someone that's been through it, can guide you, show you the ropes, and can really, provide very beneficial insight
Yeah.
to what you're trying to do.
I so agree with that because there's so much time you can waste along the way because you don't know what you're doing. I think this next generation is really better at doing that. I feel like I was the same way as you. Like when I was in college, I was kind of just like, all right, this is what I'm doing. I'm trying to figure out this is what my friends are doing. So I guess this is what we're doing. And until like late med school, that's when I was like, oh, like, I had the privilege of going to Morehouse School of Medicine. So it was like essentially like HBCU. And that's kind of where mostly I was like, okay, like all these people kind of they're going my path, and like who can I pick here to help me guide me and to get there. I feel like it's so important to figure that out early because it's like that's what you're just going to save so much time. You're like, can you imagine having somebody tell you, hey, like this is what you need to
What you
do.
need to do
Yeah.
that. Focus on this. Yeah.
Yeah, yeah. And so like whenever I see that now, like one of like things I like to do is like literally reaching back and be like, hey, this is a path. Like this the things I did at least to get here. A few things might be negative, but I mean different, but like at least I can guide somebody to like those next steps instead of just going in blindly.
I think also that people think their mentor has to be like someone that's like super well established, has all the accolades, like it doesn't always have to be that. Sometimes imagine those people probably are already mentoring a lot of people. You wanna find someone that can really invest in you and spend the time and like knows you. And a lot of times it might not be that well established professor that knows everything that's going on. Sometimes it could be like, your senior that's a year
Hmm.
above you. I had a really good mentor, even while I was in dental school since my first year. He ended up doing oral surgery at Meharry. I think he graduated. He was also a really great mentor to me. So a couple of peers, like people that were just a year ahead of me or 2 years ahead of me, were great mentors. So mentorship can come in any form.
Yeah, that's a pretty good insight. I've never really thought of that. Like your core residents can be your mentors because they have been there
Or
before you. Just pick people up and then and they would be willing to. Yeah. So we're gonna switch gears a little bit. I wanted to highlight some of the things. One of the reasons why we want to do this podcast is to highlight some of the challenges that surgical residents, surgical attendings can go through.
Mm.
And it doesn't mean that you have any, but I just wanted to ask this question. What kind of challenges do you feel like you have faced as a Black person, as a Black surgeon in your field that's kind of lacked this diversity essentially? As you know, it's not that many Black or maxillofacial surgeons out there. And so, what kind of things have you faced over the years?
Yeah. I thought it was kind of funny when you were like, or maybe you haven't faced anything. I'm like, I want to meet I want to meet a Black oral surgeon that is just like, yes, I went through this and it was just a piece of cake, walk in the park. I really want to, dude, how did you do it, man? Because it's hard. It's very, very hard. I don't care what anyone says. It's not easy because you have to think about it this way. You're stepping into a space. A lot of the rooms that I walk in, a lot of times I'm the only Black person there. You're stepping into a space that people that look like you or what you represent isn't really represented. And so off the bat, like you have to battle that as well. And then there's the added you have to prove yourself portion of it because everything you're doing is being kind of watched and being hyped, and you're kind of in the limelight, whether you want to admit it or not. But you have a lot more to prove than your counterparts. So the challenge is it's already hard getting there, but once you get there, it's not like, oh, okay, I've arrived and I'm comfortable now. In fact, it's like now you have to prove yourself as to why you deserve to be here and why, yeah, you have to prove yourself to show that like I'm not an imposter, like I possess the skills and I can do it. And I think for me, that first of all has been one of my biggest challenges is just um kind of putting that to the side. Like again, I already look really young. First of all, I look like I'm 16 and 17. So and in healthcare, people for some reason base your competency on how old you look in experience, which is fine. I think experience is a great teacher, but I think for me, once I step into a room, I'm a young Black physician, and it's just not typically seen. So most of my patient be like, "Oh, you're the doctor?" And it's like, "Yeah, I am." And it's like, "You look young to be a doctor." And it's like, I know I skipped a couple grades, I've done this. Like, how long have you been doing this? Oh yeah, I've been doing this for whatever amount. So, I'll pad it up a little bit, count my dental school and everything. I've been doing this for this amount of years. But it's that you have to get past the way you look. That's the first step. Improve
Yeah.
and gain their trust. And then the second thing I think is just approving yourself, right? So you're learning. And I think a lot of times my biggest struggle is finding the confidence that I know that I have because I'm sure you can attest to this. The moment you step into surgery as a first year, like all that confidence you thought you had in medical school or whatever, like that is stripped out of the door right away. Yeah, it's like you're the lowest and you know nothing here. So like, you humble yourself, you be coachable and you learn. And so getting past that like initial, how do I call it, like criticism and everything that you go through that affects your confidence in what you know you can do can be really hard, especially in a field that again is not super. I don't want to say I don't want to say accepting, but like you're not highly represented in.
Hmm.
It's like being a Black hockey player essentially. You got to go through a lot of you got to prove yourself. You got to show that you can do it, and that's fine. That's with anything. It doesn't even matter. Like anywhere you go, regardless, you got to prove and you got to show. You got to show out. But I think for most Black professionals, especially young Black physicians, it's a matter of like knowing that, hey, I'm not an imposter. I can do this just as well as anyone else. And just because I'm young and Black and a lot of people aren't here in this field doesn't mean that I can't do it just as good. And so even when someone, your counterpart is working an hour, if you're a young Black physician, you got to be working like 5 hours. You got to be putting in more than everyone else because you have to prove yourself and show everyone that like, yeah, I deserve to be here. Because the moment you make one mistake, it's gonna be accentuated more than anyone else. You're gonna be like, they want to find reasons to be like, hey, we
Yeah.
do this, like, So yeah, it's a fine line of being, you know, being fair, but in being and not trying to allow these things to affect you. Also building that confidence in yourself and not, doing away with every spirit of like a doubt or imposter syndrome.
Yeah. Yeah. Yeah, it's, and it's hard, to be honest. We all face it, and part of it, it's like you can be in your head a lot too. No matter how much support you have, it's like, especially
Mm-hmm.
when you walk in a room and it's like, man, I'm the only one here, or I'm the first one here. This maybe a program hasn't had somebody who's like me. It's like, so you're almost trying to prove yourself, and that's already a struggle. I feel like, it's like not everybody has to come in and has to kind of work themselves to that. Does that make sense? It's like instead of me worrying about I need to be good at surgery, I need to worry about me proving myself as
Yeah,
a
yeah.
black person. I can do this. You know what I'm saying? So it's like an extra harder that, to be honest, it's not fair to go through, but it's the reality of it.
It
Um,
is. It is.
um,
Another
but
thing I want to add is I think just to this whole thing, before we end it out, to anyone that's considering, if you're a black young man trying to do surgery, I don't want it to be like a discouragement, like, oh damn, I gotta prove myself. No, it's not. It's not. That's not what I mean. I it's something that we all realize and we all recognize, but it's not a debilitating, like in your face type of thing. I think you recognize it, but it's in your back of your mind, but it shouldn't be affecting your daily, you know what I mean? That my program is pretty diverse. We've produced a lot of black oral surgeons, so I'm not like new to that. I have good mentors that were a year ahead of me, so it's totally possible. It's not to scare you or anything.
yeah, yeah. So I have a couple questions before we finish. One of them is, if we have a medical student, we have a high school student who would want to become an oral maxillofacial surgeon. I actually forgot to ask you initially, what does an oral maxillofacial surgeon does, because most people actually don't know. I know because I'm an ENT, so I work, you know,
Hmm.
side to side
We
with
work.
a with you guys. But can you give a little synopsis on what an oral maxillofacial surgeon does, and if somebody wants to do it, what are the steps that they would have to go through to become one?
Of course. So I like to first define what the oral and maxillofacial stands for, because I think once you have an understanding of that, it will be clear. So oral, we all know it's the mouth. And then the maxillofacial has to do with the jaw. So like the upper jaw, maxillo, and then the lower jaw, and then the bones of the face. So maxillofacial. And then essentially head and neck region, depending on how type of training you get as an oral surgeon. There's different specialties that and different things that you could specialize in. Craniofacial, you have head and neck, cancer, all that stuff that work pretty close with ENT. On oral maxillofacial, it's broad scope. There's so many things that we do, from wisdom teeth extractions to implant placements to bone graftings to biopsies to dealing with trauma, facial fractures like mandible fractures, mid-face fractures, orbital floor fractures, anything that you fracture on the front aspect of your face, this facial skeleton, this area, that's what we specialize in. We work very closely with plastics and ENT. Actually, I like the biggest difference. I think ENT, you guys are specialized on like the soft tissue of the face, whereas like oral maxillofacial, we specialize more in the hard tissue, like the teeth, the bone, stuff like that. But we also work with plastics, and we do a lot of reconstructive cases as well. So a lot of some oral maxillofacial surgeons are actually dual trained in plastics, and they can do like rhinoplasties, facelifts, all of these things like facial cosmetics essentially. And let's see, then you have the orthognathics, people that have skeletal deformities where, maybe your bottom jaw is more forward or more backward than it needs to be. Then you're going into the orthognathics where we can correct your jaw position into the right proper alignment. But essentially, bread and butter oral surgery has to do with the mouth, which is like implants and dental extractions, but there's so much more we can do with the face, so much more. And then the journey is long. It involves going to getting some sort of bachelor's. It doesn't matter as long as you take the prerequisites that you need to get into dental school. And yes, all oral maxillofacial surgeons have to go to dental school. That's the first step. Once you go to dental school and you match into oral surgery residency, there's two tracks you can go to. You can do a 4-year or you can do a 6-year track. The 6-year track, you get an MD in addition to your DDS. I'm not in a 6-year track, I'm in a 4-year track. So you just go straight to residency. You don't get an MD, but there's no difference in what you can do. 6 or 4, we all do the same thing. and we're all trained and competent to do the same thing. But the 6-year track, you get the MD, and probably if you plan on staying in the hospital, it might be more advantageous for you. If you plan on going in academia, it might be more advantageous for you to get the MD in addition. But if you're planning on doing private practice, like I am, the 4-year route is a more attractive option for most people. It's a more difficult option to get into, as you would expect. Not a lot of people want to pay loans to go to med school, or not a lot of people want to go to 2 extra years of school. So that's pretty much the oversight.
Nice, man.
Mm-hmm.
So what is next for Dr. Bestman? Where are you going from here? I know you're in your residency right now. You mentioned a little bit about private practice, but are you going to subspecialize, or what's next for you?
To be honest, man, I've been in this space where, as a third year, I got to start thinking about my future plans and goals, and I'm just kind of relying on God to direct my steps. I obviously have things that I'm interested in. I think I am considering doing some cosmetics while I can, maybe doing a year fellowship in cosmetics, but and that's something I've always been passionate about. But I think right now, to answer your question, it's just like I'm just trying to see the light. I just want God to guide my steps and tell me what His purpose is for me. Like, He's brought me this far, so I'm just trying to stay on that path that He's created for me.
Well, I appreciate you, my guy. Thanks you know, for your time. I know you're busy. You just had clinic. You came out and you're willing to do this, so that means a lot. Hey guys, so thank you so much for watching another episode of the Black Surgeons podcast. If you haven't already, please subscribe to get more material like this. And also, by you subscribing, it helps spread the word and for more people to view this channel. Again, we appreciate you guys, and we'll see you on the next podcast.